Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you, as always, for joining me, for joining us. My guest is Christine Kosha from the Quincy Health Department. She is the tobacco specialist, treatment specialist, and today's topic is all about healthy addictions. So these are alternatives to smoking. Christine, welcome. Happy New Year.
Happy New Year mention. Thank you, Mark. Thanks for having me back.
You're welcome. And we should mention we are recording this program in January. However, these healthy addictions really could be applied throughout the year and any time that someone is ready to stop smoking.
Exactly. We all know that January is a very popular time of year for people to try and develop healthier habits or maybe give up old habits. So I thought it would be a great time of year to put something together and talk about healthy addictions. But I always like to make it clear to people that if you're thinking about quitting smoking or anything that you're sort of have on your mind to give up, it doesn't necessarily have to be January. Whenever you feel like you're ready to quit, that's when you should jump on it. But we have some great suggestions today on healthy alternatives and things that you can do instead of.
And as you and I were discussing before we actually started recording, New Year's resolutions, a lot of people make them, but they're only about 80% effective.
Correct. I think a lot of people, again, they sort of feel compelled to quit something once January 1st comes around. If you have people, again, that are smokers, they may feel, just like most people, that it's the best time to try and give it up. But with anything that you're trying to give up, the most important thing that you need, and the first thing that you need, is to have the determination and motivation to want to quit. Some people don't find that at the beginning of the year. A lot of times people will decide to join the gym, all of the things that we all are very familiar with. But on average, people do tend to sort of lose their focus and concentration by mid-February. Yeah, so it comes down to being ready. If you're doing something that you're not 100% committed to, then chances are you probably will sort of lose interest in it as time goes on.
And I guess before we get into those activities or those suggestions for folks, just as brief as you could be, just tell everyone, tell us, tell me why people should stop smoking. Every day there seems to be health risks associated with smoking.
Right.
They never go away. Matter of fact, they grow.
They do, absolutely. I think as we've talked about in the past before, Mark, the numbers, if you look at the numbers really across the country, not just this country, but across the world, numbers of cigarette smokers are going down, which is, when you look at it, a great thing. But the reason for that is because we have a lot of people that are picking up vaping, which is another way of getting nicotine. And we all know the reasons. I mean, nicotine is an addiction. All of the chemicals that are included in cigarette smoke and cigarette products are the things that cause illnesses for people. You know, the increased risk of lung cancer, throat cancer, all of those kinds of things. Heart attack risk increases. So all of those reasons, and not to mention the cost of it. Nicotine, I always tell people that tobacco products are always going to increase in price. That's something you can be guaranteed of as a smoker. So we've seen that happen over the years. It's going to continue to happen. And again, vaping, the studies are still out there as far as how safe vape products are. We're finding over time that people that vape very heavily are developing lung problems. And I certainly expect to see that continue over time. So, because, it's always a good idea to give up something that's a risk with your health. And I think most people know that.
And I guess just maybe to scare folks even further, to inform folks the poisons that exist in cigarettes, formaldehyde.
Yes, there are something like over 3,000 different types of cancer-causing chemicals in cigarette products. And they're all very different, but you look at things like formaldehyde, you have different types of chemicals that you would find in bug sprays and aerosol products, nail polish remover, acetate, things like that, various types of metals that are included in certain tobacco products. All of those things are very small traces of poisonous chemicals, and over time, they cause a danger to your health.
So you would think that just listening to that list, that you would never ingest these things by themselves.
Exactly.
So
Exactly.
why do it in something like a cigarette?
Exactly. And I think, again, it just comes down to the addiction of it. You know, the nicotine in the cigarette or in the vape is the thing that gets people hooked. So once you're addicted to nicotine, it's very difficult to stop. So those things sort of go along with, if you're a cigarette smoker, you have to, you know, any product that you smoke, any sort of cigarette products are going to contain some traces of those chemicals. So again, over time, with every cigarette that you smoke, you're ingesting a lot of that into your system. So those are the things that cause the cancers and the illnesses for people.
I do have quite a few pages here from Indiana University Health, and the title of this is 85 Things to Do Besides Smoking. So are we ready to get into this?
Let's dive in, yes.
So they organize this in kind of categories. Right at this moment, this is the category: eat crunchy, fresh vegetables. And I think crunchy is probably related to kind of an oral fixation.
Yes, that's similar to if somebody's quitting, we would sometimes suggest to pick up a straw or a celery stick or a carrot stick. Those are giving you something to sort of put in your mouth and something to chew on. So it does definitely help with the oral part of quitting.
On those same lines, eat a piece of candy, chew on a toothpick, chew gum, take deep breaths. So in other words, pause for a minute.
Absolutely. A lot of times people don't realize that when they are smoking a cigarette, what you're actually doing is taking a deep breath every time you inhale your cigarette. So to get people to understand, taking some deep breaths, just doing maybe 4 or 5 of them, holding each one as long as you can and slowly letting them out. It's a good way to de-stress and to release, and it's a great relaxation technique. So deep breathing is an excellent tool to use when you're in the process of quitting smoking.
A lot of us don't do enough of this, and that's drinking water. Now, they say a cold glass of water. I don't know if cold as opposed to warm would matter. Again, you know, I suppose the oral fixation.
Exactly right. And the other thing with the cold water is we know as time goes on when people quit smoking that they tend to feel a little bit hungrier as the weeks progress. That's a very normal thing. Blood sugar levels are one of the things that tend to drop when people quit smoking, which causes many people to feel hungrier. So cold water helps to make your stomach feel fuller. So the colder the better, really, if you're drinking it. So putting as much ice in there as you can. Some people find water very boring to drink. You can certainly add flavoring to it by adding a lemon or a lime or a piece of orange, anything like that, to make it a little bit more fun to drink.
And nowadays, there is the seltzer water.
Absolutely.
That folks
which is another great choice.
Can enjoy.
For sure.
Brush and floss your teeth. Well, that's probably good for just good oral hygiene. Mm-hmm. Get the mail. Well, certainly, right? That's an activity that might, I suppose, redirect your attention.
Yes, absolutely. Anything that's going to distract. We have something that's called the 4 Ds to quitting smoking, which includes many of the things that we just talked about. Drinking water, doing something else, which means keeping yourself distracted from cravings by getting involved in some other sort of activity. On average, a craving for a cigarette will last about 10 minutes. So if you know that and you're aware of it, doing something else, even breaking down the time and saying, okay, for the next 2 minutes, I'm going to keep busy with whatever it is, and then the next 2, and then the next 2, and before you know it, 10 minutes passes, and that craving is gone. So doing something else, delaying, which is sort of a similar thing to doing something else, but just when you feel a craving coming on, you just sort of put it off as much as you can, and again, after 10 minutes, it tends to go away.
So based on what you just said, there's another suggestion here, and that's to take a shower.
Yes.
That would eat up some time.
Yes.
March in place, that's interesting. Maybe dance in place.
Absolutely.
But that also would take up some time.
Absolutely. You're really looking for anything that you can come up with. The fourth one I wanted to mention too before we move on is the drinking water. So that was the 4th D when we were talking about them. Okay. These things are just, you want to come up with as many things as you possibly can to keep yourself busy, especially in those first few weeks of quitting. Because those cravings can come on, depending on how you decide to quit, if you decide to use some sort of form of nicotine replacement therapy like the nicotine patch or the gum or the mints, they certainly will help because you're going to be getting nicotine from those products. But we have, that tends to take care of the physical craving. The mental craving is another part of it. And the mental craving is the thing that takes a little bit more work. That's the times of day that you're used to smoking, the triggers that cause you to think about smoking. You want to make sure you have a plan in place to take care of all those things and be prepared for them. So that's why coming up with all of these things are a great way to keep distracted.
I also spoke to you about this next one just moments prior to the show. Think about your reasons for quitting.
Yes.
And I bring this up because when my son was born, he's now 21, so it was a while back, but I think when he was 4, my father-in-law and my father, well, me as a parent, I didn't want them smoking next around my child.
Right.
So they, and I suppose I, used that as motivation to stop.
Sure.
And it worked.
It's a great motivator, really. Absolutely.
So think of reasons.
You really do. I think it's a good idea before you even set out on your quit plan, which we've talked about in the past, I know, but a quit plan should include everything. It should include how you want to quit, when you want to quit. You want to write down those reasons for wanting to quit in the first place and keep those with you and look at them every day. It's really important. One of the things that I was hoping to touch on a little bit today as far as healthy addictions, I think when people make that decision to quit smoking, no matter when it is, a lot of people tend to look back too much instead of looking forward. Some people tend to dwell a lot on what they're giving up. For many people, cigarettes have been sort of like a best friend, have been there for a very long time. It's difficult to imagine life without them. But what I like to try to get people to do is focus on all the great things that are ahead of them, all the great things that you're gaining when you quit smoking. You know, health-wise, your lungs are going to be clearing out, your energy level will improve. Every day that you don't smoke, you just feel better and better. The money that you save, just the inconvenience of being a smoker, and just knowing that it's always sort of had a hook on you, telling you that you need to go outside and have a cigarette. Things like, if we're getting bad weather, your first thought as a smoker is, do I have enough of cigarettes so I don't have to go out later? If we're getting snow or that sort of thing. It's such a great freedom to be released of that, and you don't have to worry about those things anymore. So there are so many great things to think about going forward. But I understand how difficult it is. I mean, we remember that smoking is an addiction. And again, for people, many people, it's something they've done for a very long time.
And I guess also consider where you might not be able to go if you do smoke, because there are a lot of smoke-free environments.
Exactly. I mean, that's another thing. No matter where you are, you always have to be aware of that. Where can I go to have a cigarette? I can remember years ago there would be buildings, even hospitals, where you would see people right outside the door. So you'd be trying to get in, and they'd be standing right there, smoking, and it would be something that you would have to walk right through. Most buildings now have a distance. It's usually about 20 feet, something like that. So you need to be a good distance away. Other places have designated smoking areas, but those are all things that you have to sort of find and seek out as a smoker. And that, I would imagine over time it gets difficult for people to want to, I think you get tired of it after a while.
Let's look at kind of the next category, and that the title of that category, or this category, is Get Out and About. Take a drive, walk the dog, read a book. I suppose you can read a book inside or outside.
Right.
Go to the library, go to a museum, take photographs. So I guess we're talking, hobbies.
Yes, absolutely.
Go fishing. Watch the sunrise. I suppose you can also watch the sunset.
Yes.
Play in the snow or rain. I don't know how much fun it is to play in the rain. Go hiking. Go to an amusement park. Take a walk in the woods or a park. I do that quite a bit. A lot of us do. And, enjoy the sunset. So they did include the sunset. But
Yes.
These are all activities that would, I suppose, take you away from that 10-minute craving that you
Right.
spoke about.
Right. And they fall under, when we go back to those 4 Ds of quitting, the doing something else and distracting yourself. When you mentioned the going to libraries and museums, I think you should, one of the greatest things about doing those sorts of activities is you're learning something where you're going. So you're kind of doing things to keep yourself busy and distracted from smoking, but then going to a library or going to a museum, looking at some great art or a history museum or whatever it is, you're taking in a lot of great things and you're learning something. And so it's an activity that's going to benefit you, and things like that are great.
Now, if we are staying inside, we mentioned picking up a book. Again, people could pick up a book
Yes.
and read it outside or inside. Call a friend, text a friend, I suppose, as well. Play with your cat if you have a cat, so any animal.
Yes.
And we should mention that that animals are a happy distraction.
Absolutely. If you are somebody who is a dog owner, if you're lucky enough to be a dog owner, I think there's nothing better than putting together a plan of getting out there and walking. I mean, your pup is going to love you for it. I mean, you do it anyway. You need to take them out at some point during the day. But if you put together a plan after you've quit smoking, where you know you're going to be going out, it's going to be a great distraction for you. They're going to be thrilled because they're going to get out a lot more than they were, I'm sure.
And just indoors. Play with your pet indoors.
Absolutely, yeah. You can. Everything is a great distraction. So whatever you can do to keep your mind off of smoking, or especially those times of day. Part of the quit plan is, for many people, sort of recognizing what times of day are more difficult for them. The morning is always a big one for people as soon as they wake up. Things like after meals, after eating, that's usually when you get a craving that's quite strong. So you want to make sure that you're ready to do things at those times so that you're ready for those cravings and you have something else to keep you busy.
So I also want to mention, it just occurred to me that during times of stress, a person is more likely to go back to smoking if they had previously gave it up.
Absolutely. And again, it goes back to if people being smokers for a long time. Most of the time as a smoker, if you're having a bad day, any kind of a stressful day, your first inclination is to turn to a cigarette, and you have that idea that it's de-stressing you and calming you down. But as we talked about the deep breathing earlier, that's actually what's calming you down if you think about it. I mean, the inhaling and the exhaling, you can do that without the cigarette. And if you find you do that, again, take 4 to 5 deep breaths, nice, very slowly, you're going to find that it's going to calm you down the same way that the cigarette did.
And saying that, I want to add, there's an app for that. Folks might be aware of Calm.
Oh, yes.
Something
absolutely.
like that. Certainly, maybe go on to YouTube and find some relaxing music, some relaxing visuals.
Absolutely. There are so many. I think that's one of the great things about the internet now. We have access to so many great tools. There are a lot of apps like that where you can just sort of calming noises, things that are going to relax you. All of those things are great. I mean, you can certainly go into any store now and pick up some of those sort of alarm clock type things where they have a sort of gentle music that plays or calming music. You can get those things anywhere, and they are a big help.
Continuing with my list, or the list from the university, write a friend an email, do a crossword puzzle, keep your hands busy with knitting, crocheting, and needlepoint. So we talked about this oral fixation,
Right.
But the holding of a cigarette, that's also a feeling too.
It is. That's all part of the addiction of smoking, the hand-to-mouth piece, where you have something, you're used to having that cigarette, you're used to smoking it. Having a pen, a pencil, anything like that in your hand is going to be a big help until you can sort of get yourself over that. And that, again, is part of the, kind of like the mental piece, or, the piece that you have to sort of get yourself out of. It all goes along with the whole habit of smoking. So you do have things that you can replace that with. And again, carrot sticks, celery sticks, you can hold it in your hand and then you can crunch on it. So they serve two purposes.
I thought this one was interesting, and there seems to be a lot of interest in this, and I think maybe even after the first of the year, more so than any time of year, not that it's timely per se, but where did I come from? So genealogy, start a search.
Absolutely. Again, as I say, if you're going to do something to keep yourself distracted, why not make it something interesting? Learn
And something that could take a while.
Absolutely, yeah. I think if any one of us were to get involved with something like that, you can go as far back as you want to, and that certainly is something that will take up some time for you. And you find when we talk about reading and getting involved with reading a good book or a crossword puzzle or something like that, when your mind is involved with something else, you don't have time to think about cravings that come up. So you find, even if you start out by having a craving, but you think, okay, I'm going to pick up this book and read a couple of chapters, sometimes you find that you're going to continue on and you don't even notice, the cravings come and go, and you're so distracted. That's the power of your mind. If you put something out of your mind and you focus on something different, you find that you can conquer it.
One of the things I didn't find on this list, there is write a poem. So that's a creative venture. There
Absolutely.
is make a card for someone, again, creative. Play an instrument, learn an instrument.
Yes, absolutely. I couldn't think of a better time when you're doing something like quitting smoking to learn a new hobby, pick up something good. Again, what we're looking for here is things that are going to help you to get over those first initial weeks and months when you're trying to quit. You're developing new routines, a new lifestyle, really. So you're really replacing those negative habits with positive ones. So I couldn't think of a better time to pick up something like learning an instrument, or maybe learning how to dance, or taking some dance classes or some swimming classes, something you've been thinking about but never actually did anything with. So it's the perfect time.
Learning how to dance would eat up a lot of my time, because I wouldn't do so well at it. I need a lot of instruction. Feeling productive. These are basically household tasks.
Right.
Scrub the floor, organize a drawer, pull weeds, go grocery shopping.
Right.
These are things that we all pretty much are used to doing.
Right.
Maybe we can just redirect our mind at any given time and say, well, maybe I'll do that task now.
Absolutely. I think it makes sense when you're putting that quit plan together to sort of make a plan for yourself and say, okay, to fill in the time, which I know I'm going to need to do because of these cravings, I want to be prepared for them. So maybe I will sort of plan to sweep around the house or do the dishes, or maybe even paint a room if you're feeling ambitious. You know, do some reasonable changes around the house that you can do. Those things are all going to play a big part in getting you through cravings. And the great thing is, you're making improvements. They're things that are going to help you. And down the road, you're going to not need to do them as much as the cravings become less and less, and you're feeling better and more energized.
Number 56 on this list of 85. Visit a retirement home. And I also am going to add to that, volunteer.
Absolutely. What a great idea. I couldn't think of anything better. It's a great way to spend your time. You're seeing people that you can learn things from. More than likely, you may have people that have been in the same boat as you, maybe former smokers who can give you some guidance and let you know what worked for them. I couldn't think of anything. Having the health department down with the Kennedy Center, it is such a great thing for us to be so close and to meet with many of the seniors who take advantage of the Kennedy Center, and such many wonderful people that I've met since I've been with the health department. And they take full advantage of the Kennedy Center, which has so many great programs to offer.
Let's talk about, I suppose, strength in numbers. We talked about reading a book, kind of distracting yourself, in sending your mind in a different, healthy direction.
Right.
So let's talk about book clubs. Certainly a place like a senior center has book clubs, but not only a senior center.
Absolutely. I think you could find, I'm sure if you visited the library just across the way here, any place like that, friends who, a lot of people get together with their friends and they form book clubs. They get together once a week or every couple of weeks to discuss a book that they're reading. Things like that are great. Of course, we know there's strength in numbers. So when you're doing things as a group, no matter what it is, book clubs, walking clubs, we talked a little bit about earlier, it's great to have other people with you. You get that, you have that camaraderie with people that are with you, and you can also get a lot of motivation from other people when they're doing the same things, and you're doing things with people and not just alone.
And as we talked about some of these items on this list, and we kind of mentioned them as a singular item, you can combine too. So you can take a hike and take photographs along the hike. So incorporate a hobby with, I guess, a exercise activity.
Absolutely. Yeah. I mean,
And then find out you like it.
absolutely. I think it sometimes, I think, again, when you're looking to change one habit and develop something else, especially if you're trying to develop a habit or a new habit after quitting smoking, it can be overwhelming at times because you are making a major change to your lifestyle. These are, for a lot of people, things that they've never done before. So starting out gradually is always the best way to go. If you find you want to do something like develop a walking plan, it's best to start out slowly, maybe once a week to start out. Maybe you go out for 15, 20 minutes. You get used to that. You pick a route that you like, something that's interesting and distracting. Maybe bring your camera along, that sort of thing. And then once you get used to that, add another day or maybe add another 5 to 10 minutes to your walk. And before you know it, you have a routine where you're out there 3 times a week, and maybe you're up 45 or 45 minutes to an hour. And I think a lot of times people surprise themselves. They get into these new routines and they find that they really love it and they don't want to miss it.
Play a game, a board game, but I suppose also an electronic game.
Yes.
Again, just get your mind headed in a different direction.
Absolutely. Any sort of distraction that you can come up with. Games are great. I mean, there are a lot of those handheld. You can do them on your phone now. Those are excellent to keep your mind distracted. I mean, I know just from people that I've seen personally, they spend so much time on games and phones just to be distracted, and so much time goes by you don't even really notice it. So when you're doing something like quitting smoking, it fits in perfectly.
And again, getting back to what you had said earlier, that a craving would last for about 10 minutes, that's not a long period.
No, it really
to
isn't.
distract yourself.
Absolutely. On average, it's about 10 minutes. So usually when I tell people that and I make them aware of it, they sort of have it in the back of their mind. So they know that just by the next time a craving comes around, just by looking at the clock, again, it's sort of breaking it down to every few minutes if you need to, and keeping yourself busy with whatever you possibly can, you're going to notice that craving will go. And it leaves and it will pass whether or not you smoke a cigarette. Some people think, this craving isn't going to go away until I give into it. But if you're keeping yourself distracted, you'll find that they do go away. And the good news is, as time goes on and you're not smoking, they become shorter and shorter.
These are common. All these things we mentioned are common. People don't often think about them.
Absolutely. Yeah, they really are. There are things that we pretty much do in our everyday lives anyway, but you realize how important they are when you're doing something like trying to quit smoking. This is why a quit plan is very important. You want to make sure that you're prepared. It's very easy for a craving to become overwhelming if you're not prepared for it. So you want to make sure that you take advantage of these things. Keep those 4 Ds in mind. Doing something else, distracting yourself, deep breathing, and drinking the water. Those things are going to be a big help when you're trying to quit. And again, whether it's the first of the year or springtime or summer, whatever time you choose to quit smoking or whatever it is you want to try to give up, you want to make sure that you're determined and you're ready and you have a plan in place. That's the most important thing.
You said that perfectly. So I want to thank you for coming in.
Sure.
Certainly a great program.
Thank you,
Christy.
Mark. Okay.
And thank you at home for watching, and please remember to support the local access station in the community in which you reside. Take care.